think trainees should come to NYU Langone to train in vascular surgery because it is such an exciting place to be. It's number one in vascular surgery, in cardiac surgery, in cardiology, and multiple other specialties. And the reason why is because the quality is the best.
In academic medicine, academic surgery, we have 3 different missions that are all integrated. The clinical mission, research, and education.
When trainees come here, they know that they're going to get the full breadth and depth of a vascular surgery experience to complement their training.
The group in vascular surgery is doing super fascinating things. High-end, technological, advanced aortic surgery, high-end endovascular, venous surgery, and all number of different types of vascular surgery. So it's just a super exciting place to be right now. At NYU Langone, we're fortunate to have both an integrated vascular residency and an independent vascular fellowship.
The first 3 years, our residents are able to participate in general surgery rotations along with vascular surgery rotations, with progressively over the first 3 years, fewer and fewer general surgery rotations, therefore fine-tuning them to then focus only on vascular surgery. And then as 4s and 5s, they're expected to run the service just like any other chief, any other fellow, staff consults, be able to start cases and really help even us plan or even change some of our case plans.
Here at NYU Langone Health, our vascular fellowship program is incredibly robust, and it goes right along with the vascular residency.
We have 2 unique simulation centers here, and in those simulation centers, we're able to work with each other as well as attendings to do cadaver labs multiple times a year, as well as non-cadaver labs. And this is a great pro of the program because it's something that we have access to year-round, 24/7. Fortunately, we have 3 training locations here, and they're all very different from one another, but are very synergistic in nature. At NYU, you have the flagship hospital. It's very academic, ranked very well in the world, and does the cutting-edge techniques that most places can't offer. So you're able to see everything that's the latest and greatest in vascular surgery. At Bellevue, our experience is vastly different. We're working with a significantly underserved population. Bellevue is a referring site and is a flagship for that entire system of about 13 hospitals. So we do everything from complex endovascular surgery to dialysis access to bread and butter vascular surgery at that hospital. And it's a fantastic experience because you're working with underserved populations, you're giving back to the community, but at the same time you have very advanced pathology that you might not see at other hospitals. And then in addition to that, we also work at the Manhattan VA. So you're working with a completely different patient population, which is the veterans population. And these patients come from everywhere from Pennsylvania to the Bronx to New Jersey to get advanced endovascular and open vascular care at the Manhattan VA.
It's just an incredible combination of different settings that our residents train in. And I don't think there's any other institution like that in the country.
And all of those are within a few blocks of each other. And we're sending our trainees to all of those places so they can experience different types of practices, different practice styles, different ways of treating patients. And the patients themselves are different in each of those places. And I think having that exposure and seeing those different practice patterns and those different practice settings really enhances the training program, enhances their understanding of how to take care of vascular patients, because each of those settings is different, and each of those settings is really important for their training.
We also have the unique opportunities of having one of the only academic vein centers in the country. And in addition, we have one of the only academic outpatient-based laboratories in the country. It gives them a completely different perspective. It teaches them about cost effectiveness, cost utilization for treating vascular patients. And so it really rounds off the training that's provided here.
We start teaching in this program from day one. We have medical students, we have visiting medical students and sub-interns, we have visiting residents. And so from day one, we're prompted to take these students through the world of vascular surgery. Some of my favorite cases are when there's an attending in the room supervising everything, and we have a senior trainee take me or another junior trainee through the case.
Our trainees have a lot of education opportunities as well as research opportunities. There's conferences almost every day on various different topics, whether on research, on interesting cases, case preparation, morbidity, mortality, of course. They have opportunities at the skills lab to work on skills outside of the operating room. They have the ability to interact with various different specialties, and we're able to collaborate with cardiac surgery, surgical oncology, thoracic surgery. Everybody, honestly, can be integral to our trainees' training. Our fellowship is a 2-year ACGME accredited program, and the fellows are immediately immersed in some of the most complex pathologies, including aortic, carotid, peripheral arterial disease, and vascular access in general.
Surgical innovation plays a big part of the vascular surgery division in the vascular surgery program. Our faculty are, without question, some of the best innovators in this space. We have folks who have worked in device design, in trials and validation, and in commercialization.
There's a lot of opportunities for research at NYU. There are several attendings who are involved in clinical trials and clinical outcomes research, and we also have faculty here who are involved in basic science research. Being a part of research has been able to contribute a lot to my critical thinking skills, which has helped me grow as a surgeon, and also it's been helpful for me to be able to learn how to contribute more to the field of vascular research in general.
At NYU Langone Health, the training experience is unmatched. Our faculty here are world-renowned in every field: complex aortic disease, complex venous disease, complex peripheral disease. They're presidents of societies, they've published in textbooks, they've been involved in innovation, and so it's amazing to learn from all of these folks who have not only excelled, but excelled in different ways. For us personally, we like to call them mentors, but I think it goes further than that. These are people that we can talk to about our personal lives, clinical questions, academic pursuits, career advice, and I think that closeness with people who are so far along in the field is pretty unique.
We value mentorship greatly. There's a formal mentor-mentee program that we put together that falls into place day one when the first trainee comes in, and it progresses throughout their 5 years of training. In addition, because the trainees and the faculty work so closely and so well together, other mentor-mentee relationships develop organically throughout. They can be geared towards clinical work, they can be geared towards research and discovery, they can be geared towards education. Across the board, we work on these mentor-mentee relationships so that we can get them through training, get them to go out there, become vascular surgeons, and it gives our trainees really the option of going into any sector of society that they choose to when they complete their training and become leaders in the field. One of the greatest things about our program is that it's in New York City. It's really an amazing place where when you step out after a long, hard day's work, you can do any number of things, from running the New York City Marathon, to going to the museum, to just going to a hole-in-the-wall restaurant right next door.
There's always something open no matter what time of day it is, and I think that's the best part about training in New York. You work really long hours, very hard hours, and when you get out of here in New York, the city's always open. You always have something to do and someone to hang out with. I think that's why I think it's the best city in the world.
I recognize that not everyone has moving to New York City on their bucket list, and truthfully, I didn't have moving to New York City on my bucket list. But I moved here from sunny Southern California because the trajectory of NYU is like a rocket ship. And now, I'm very fortunate and proud to call New York home.